Good morning, Patrick here from Complete Health, and I just wanted to let you guys know that we've got another spinal screening this weekend. So it's on both Saturday and Sunday. I believe our Saturday tickets have pretty much sold out. However, there are still a few spaces available on our Sunday time slots. Now, why do we do spinal screenings, or what is a spinal screen? Well, I don't know whether you've noticed that there is a pandemic going on, and trying to get an appointment with doctors at the moment, or with a physiotherapist or a rehab specialist at the moment, is almost near impossible. Good morning. So trying to get in with someone to have an assessment is almost near impossible. So why are we doing these regular spinal screenings? So we've been doing posture screenings and spinal screenings in the clinic roughly for the last 6-ish months. Why? Because we realized there was a gap or a void in our health service at the moment where someone could come and speak to a practitioner and see if they were the right fit for them. So what do we do on a spinal screening? Well, the majority of our patients will already know this, is that we always use posture analysis. Why? Because with the posture analysis, we can start to identify whether there are nerve injuries, whether there are joint injuries, whether there are bone injuries, whether there are ligaments, tendons, and all of the compensations that come alongside that. So by just looking at the way that someone stands front on and to the side, we can start to see where people are starting to put stress through their body, through the ligaments, through the tendons, what compensations are happening, what muscles are starting to spasm, and whether that is something that we should be able to help that person with. That is the point of the spinal screenings. Now, this fills a gap at the moment because there are a lot of people that are confused as to what to do because they can't get an appointment with either their doctor or their physiotherapist or a rehab specialist, whatever, because the NHS physically do not have time to do these things at the moment. They are, what I would like to say, are firefighting. They are trying to cope with the overload of all of the other work that has built up as a result of this pandemic. So that aside, these spinal screenings that we do roughly every 6 weeks are completely free of charge. They're completely free of charge. People can come in, have a completely free spinal assessment, understand what their problem is. We can give them an idea of where we're going to go with this and whether that person is going to need further assistance with that problem, or whether that problem maybe isn't now giving them pain or injuries, but whether it's going to give them pain and injuries in the future, and what we can start to do to try and prevent that. So the idea is that we give you an overview. It is not going to be the full details, but if you know someone that could specifically benefit from this type of work, we are holding these again completely free of charge. Again this weekend. I believe that most of our Saturday slots are gone. However, our Sunday slots are still available. And again, like I say, completely free of charge. We'll go through those posture screens. We'll do a front and side view. We'll have a look at your alignment. We'll see how that is actually impacting your injury or your pain. And then, like I say, you can either take the option to correct that with us, or we can give you the right advice of where you need to go. But just bear in mind, anybody that is trying to go through the NHS for these kinds of things, I've just had patients come back from when we did spinal screenings in the summer, and they still cannot get in with the physiotherapist or the right neurologist with their doctors or their surgeries at the moment, because it just literally isn't the time. It just literally isn't the time. Patrick here from Complete Health. If you know someone that can benefit from this, please send them to our Eventbrite page. It's on Eventbrite that we have tickets. You have to book a slot because of everything that's going on. You can't just turn up. We have to have people booked into specific slots so that we can control the volume of people coming through the clinic. Patrick here from Complete Health, and I'll speak to you guys again very, very soon.